and welcome back to Healthy Living. I'm Issa Boz and I'm here on location in Rota for the 2016 Cope North Humanitarian Training Exercise. I'm here with Staff Sergeant Carlos Rance and Captain Marianne Eisma. So can you tell us a little bit about what went into the preparation of this exercise?
What goes in preparation of Cope North? It's an exercise that medical is involved in where we are getting familiar with the eMeds HRT package that we have here at Anderson's clinic.
All right, so I understand that this is meant to respond to disasters throughout the world. You guys are the first responders and you can get there in close to no time. Can you tell me how long does it take to actually mobilize this health unit?
So the package is designed for PACAF, which is our Pacific region area, and the package can get there within 24 hours of notification.
All right, so what kind of, I noticed there's a lot of different facilities, a lot of different tents here on location. What kind of, what does that encompass?
So as we get ready to deploy to the location, first the areas that are going to be operational would be ER, our OR tent, and ICU, as well as an outpatient clinic and a logistics area. All those will be fixed within a 12-hour period of landing onto the site.
Wow, that's really fast. And so I guess you guys are kind of like the people who get in there when no one else can get there right away, when all the other first responders are kind of stumped with a disaster.
Yeah, so once we're notified, once we get to the location, the first thing we'll do is once we get there is get our go bags and all our foreigns and our docs that actually can go out there and start treating patients on the ground. And then as that's being done, the rest of the team that's with this package would actually start building our tents. And the first tent that will be built would actually be our ER tent, and we would start populating as we go. But once the ER tent is up, we can start seeing patients within a 2-hour period.
All right, well today's exercise, they have about 90 personnel on site. So I'm here with Captain Eisma, and she's actually a physician. Can you tell us a little bit about your field?
So I work with internal medicine, but the area that I'm working here on site is with a primary care clinic. So typically what we're seeing is things that you typically see in an urgent care setting. We have 3 doctors on site, myself as the internist, we have 1 pediatrician and 1 OB-GYN doctor. And like I said, a lot of the things that we're seeing is an urgent care type setting. So things that we've been seeing are bites such as insect bites, dog bites, snake bites. We have been seeing ankle fractures. Those type of patients, we can initially treat them, but we would have to have them air evac. We've even had a patient come in that was pregnant in active labor that our OB doc was able to deliver her child.
Wow, so it's definitely a wide range of medical services that are offered here. And so I did mention that this isn't for a long-term, a long-term hospital. As you see behind us, it's just tents and desk doors full of medicine. So for people who can be treated, can you tell us like how you try to stabilize it and how would someone be evac'd out?
So the first thing we have to do is that we just have to make sure that they're hemodynamically stable, that their pain is under control. If those things are not controlled, then they would not be able to qualify to be evac'd back to the main island. Then once they're stabilized, we would have to go through the flight physician that would review their records to make sure that everything looks in order, that they're stable, and then they would give the go-ahead for them to fly back.
Okay, one thing I mentioned, or that you mentioned actually during today's tour, is that you guys have the capability of dealing with people with infectious diseases. So how would you guys go about dealing with that here at the site?
So it really depends on what it is. So for example, that person that came in with the abscess, we went ahead and we incised it and drained it and treated them with antibiotics. But for example, the patient that came in with active TB, because we don't have the capability to quite treat their TB, the main thing was to make sure that they had proper isolation. So we had a negative pressure isolation room set up that can basically prevent the spread of the disease. And the patients or anybody that comes in contact with that patient, we had them wear protective gear.
Okay, I understand that this is something that has been used in different disasters throughout the world. Can you give us an example?
I wouldn't, because I haven't been in a deployed setting.
We've this sort of package has been used for things like earthquake, not the most recent earthquake, but if we had anything like that within the Pacific region of a earthquake, a tsunami, any storm where there's an impact of a lot of patients and a lot of things where local personnel will not be able to respond to that, us as the military here at Anderson have that capability to be able to stage a clinic to be able to prevent and maybe treat those individuals and get them to the proper care.
All right. Thank you so much, guys. All right, well, stay tuned. We'll have more healthy living after the break.